The national government and county governments has left patients in limbo following the official commencement of the nationwide strike on Wednesday. The industrial action has crippled healthcare services in public hospitals across the country, with healthcare workers accusing the government of failing to honor the 2017 bargaining agreement.
For the second consecutive day, public hospitals across the country have remained without healthcare workers, forcing some patients to return home while others seek treatment at private health facilities. The dispute between healthcare workers and the government dates back to 2013, when the union representing the workers was established. This eventually led to the signing of a collective bargaining agreement (CBA) in 2017. However, according to union leaders, the agreement has not been fully implemented to date.
We have given it our all, but it's unfortunate that they are not listening to us, and that's why this is the last option that we had to take. But we have been negotiating with them, but they have decided just to decline our demands, and they have decided just to ignore us, and that is why we have ended up in this.
Among the key demands contained in the agreement are salary increments, payment of risk and hardship allowances, promotions, and the permanent employment of universal health coverage UHC healthcare workers across all 47 counties.
It is good to clear that we started negotiating for a collective bargaining agreement in 2013, immediately after registration of the union. We negotiated for a CBA that did not see the light of the day because the government became undermanned.
I want also to report that the strike has started on very well. It is very successful, and we are going to be having demonstration across the regions. We will be organizing for one coast region, Nairobi, Western, Rift Valley. Will be doing like that as time goes by. Lakini sisi tuko tayari kukaa nje mpaka siku ile haya mambo yatatekelezwa.
The healthcare workers have accused county governments of being the biggest obstacle to the effective implementation of devolved healthcare services.
Mkataba wa kurejea kazini, mkataba wa kufanya kazi wa wauguzi. Tuko na wauguzi wenzetu ambao ni wa Kisii, ambao 46 ambao waliweza kutolewa nje mwaka wa 2021 na wajai kurejeshwa kazini, wajai kupokelewa kule Kisii bado.
Fight for yourselves. What you do, fight and redeem your dignity. If you backtrack this time, nobody will respect you in Kenya.
As the standoff continues to intensify, patients in various parts of the country continue to suffer as they struggle to access healthcare services at public hospitals. At Embo Level 5 Hospital, for instance, hospital beds remain empty as patients arriving at the facility are forced to leave without receiving medical attention.
Nimekuja hapa Level 5 kuleta mtoto wangu, lakini vile tumeingia tumekuta hata hakuna madaktari, risiti tumechukua, lakini hata ukiingia hakuna daktari anakushughulikia. Ndio sasa tukarudi nyumbani.
Nasi sawako na wewe siona dokta, ni lazima upitilie kwa nasa ama clinic officer. So nimerudi nyumbani, sijasaidika. Hii serikali ya county ya Embu imeshindwa na kazi kabisa.
Some patients at the hospital have blamed the Embu County government for what they describe as negligence in resolving the dispute. In Samburu County, the situation is no different, with patients continuing to seek medical services elsewhere as the strike persists. Meanwhile, the Council of Governors has threatened to take legal action against the striking healthcare workers, arguing that the industrial action has disrupted the provision of healthcare services.
Fanyeni mgomo, hatujawafuta, wacheni mahakama iweze kuamua. Mkiamua mnataka kuendelea na mgomo na mahakama imewaambia muregee, sheria itafuata kazi. Kama mahakama imewaambia regeeni na mkiregea kazini, milango yako wazi, mupangiwe kazi, muweze kufanya na wale ambao kwamba watakuwa ni wapya tayari washaweza kuingia.
The chairperson of the Council of Governors Health Committee, who is also the governor of Mombasa County, Abdul Somad Sharif Nasir, has directed the Public Service Board (PSB) to recruit 573 additional healthcare workers to bridge the gap created by the 1,013 workers currently participating in the strike.